Help if I turn on the microphone. The House Insurance Committee will come to order. And Mr. Clerk, will you please take attendance?
Chair Harris.
Here.
Representatives Tisdale.
Here.
Leitner.
Here.
Posthumous.
Here.
Aragona. Nyer.
Here.
Schutte.
Here.
Carter.
Here.
Tate.
Here.
Fitzgerald.
Here.
Witset. Mr. Chair, you have 9 members present, a quorum.
Thank you. And can I have a motion to approve the minutes from the September 17th meeting? And Rep. Schutte offers that motion. Thank you, sir. Seeing no objection, the minutes are approved. And first on the agenda is testimony on House Bills 4703 and 4704, introduced by Rep. Jennifer Wortz. And we are joined today from Nicole from Rep. Wortz's office. If you'd come up. You can start whenever you're ready. Thank you for being here.
Well, thank you, Chair Harris and members of the committee. Representative Jennifer Wortz could not be here today in person. I am Nicole, her legislative aide, and I am here on behalf in support of House Bill 4703 and 04. These bills require health coverage for group prenatal care appointments. Group care is an option available that gives new moms more time with providers and a chance to interface with other moms and hear about their experiences. It has demonstrated positive impacts on health outcomes for both moms and the babies. We welcome your support of these bills. Centering Healthcare is also here today virtually to speak to these bills, and I encourage you all to direct any questions to them on them. Thank you.
Thank you for being here. And I believe we also have Disha Patel from Centering Healthcare online. Hi, Ms. Patel.
Hi, can you all hear me? I was having issues unmuting.
We can. Go ahead whenever you're
Awesome.
ready.
Well, good afternoon, Chair and committee members, and thank you, Nicole, for the introduction. My name is Disha Patel, and I'm the Manager of Health Policy at the Centering Healthcare Institute. I'm here to express my strong support for House Bills 4703 and 4704, which ensure that all Michigan mothers, regardless of insurance type or location, can access centering pregnancy, which is an evidence-based model of prenatal care that improves health outcomes. Centering addresses rural access challenges by offering flexible care options, which include in-person, telehealth, and mobile delivery. It reduces health system burden by keeping mothers out of emergency rooms, lowering NICU admissions, and avoiding hospitalizations, and centering supports local clinics without costly infrastructure expansion. In 2024, centering preterm birth rates were at 8.7%, where the national average was at 10.4%. The low birth weight rate was at 6.1%, and the national average was at 8.6%. And the NICU admissions were reported at 5.7%, and the national average was at 9.8%. Recently this year, the American College of Obstetricians and Gynecologists recognized group prenatal care models such as centering pregnancy as effective evidence-based practices that improve maternal and infant health outcomes. And lastly, the Michigan Department of Health and Human Services recently recognized centering pregnancy as a significant factor in achieving Michigan's lowest infant mortality rate on record. We currently have 41 centering pregnancy sites in the state, and further expansion is anticipated due to the continued allocation of $5 million in grants for fiscal year 26. This program really aims to enhance group prenatal care access and improve outcomes for Michigan mothers. Thank you.
Thank you. I appreciate that. And we're going to open it up to questions from our members. I think Rep. Fitzgerald, I'll let you go first.
Thank you, Chair. One question I have is regarding current status of group prenatal care. Is this something that is currently at the discretion of a provider for it to be covered by insurance? Is this something that is rarely, if ever, covered by insurance for group prenatal care services? Can you just explain the current environment and how this mandate to cover would differ?
So, are you asking if this becomes a bill, would all providers have to provide group prenatal care?
In some ways, yeah. I'm curious to know what the environment is right now. I understand, we're dealing with Medicaid, and my point is, what is the current environment for this to be paid for? Is it private pay only? Are we, are there nonprofit groups who help to support some of this? I'd like to just understand kind of the economics of it.
Yeah, so currently Michigan Medicaid is paying $45 per patient per session and covering federally qualified health centers as well. This bill would require that commercial payers also cover this benefit at the $45 per patient per session.
Thank you.
Vice Chair Tisdall.
Thank you. Why is it not covered now? Is there something in the law or in the policy contracts that talk about individual care versus group care?
I'm sorry.
Yeah. Why is it not covered now?
It's not covered by commercial insurance. It's something that hasn't been advocated for Medicaid. We have 10 states right now where all their state Medicaids cover enhanced payment for group prenatal care. We usually start with Medicaid as they're our most vulnerable populations, and we then work with payers to replicate what their state Medicaid agency is doing to bring group prenatal care to all populations.
Is there something in the billing codes that limits it to individuals that would exclude? Is there a billing code that is for group that's not covered, or I'm assuming there's something in the contract that's kicking this out. I'm just trying to figure out what that is right now.
Yep. So in the Medicaid policies, it is written that this is only for Medicaid patients. This does not cover any patients under private insurance.
And why? What was the rationale for that?
That I'm not sure about. I'm sorry.
Okay. Thank you.
Any other questions? No, I have one. I'll finish up. So does this mandate that patients have to utilize this program?
No, it does not. This is a practice-based, provider-based program, and a lot of our sites will offer an opt-out or an opt-in program. So when a patient does come in and they are pregnant, they will be, offered centering and given information about it, but the patient is not required to do centering.
And if they choose to start the program, but they figure that this doesn't fit into their needs or their schedule, is there anything that's an issue if they drop out? Are they required to pay instead of the insurance, or?
No, there's no additional fee for the patient. They'll if they drop out of centering, they'll just continue with their individual appointments as they would with their provider.
Okay, great. Thank you.
You're welcome.
Last chance for questions. Anybody? No? Okay. Thank you both for being here. We appreciate it. Give Rep. Wortz our best. All right. I'm going to read in some cards of support on 4703 and 4704. Elizabeth Cutter from the Michigan Health and Hospital Association does not wish to speak and supports the bill. Again, on 4703 and 04, not wishing to speak, supports the bill is Amy Zagman from Michigan Council of Maternal and Child Health. We have not wishing to speak and supports both bills, Alex Cisak from Memorial Healthcare. Not wishing to speak and supports the bill, Joanne Bailey, President of the American College of Nurse Midwives. And we just heard from Disha Patel, supports the bill, and from Centering Healthcare. All right. Next on the agenda is House Bill 4666, sponsored by our very own Minority Vice Chair Carter. Welcome, Madam Vice Chair. I know no one's there to pull the chair out for you. You can start whenever you're ready, ma'am.
Good afternoon, Mr. Chair and members of the committee. Thank you for the opportunity to speak today on House Bill 4666. This bill is straightforward, but it carries great significance. It removes the word colored from the Michigan Insurance Code and replaces it with inclusive language such as person or individual. At first glance, this may seem like a small technical correction, but I want to be clear, the words in our laws matter. They reflect who we are as a people and the respect we show to every Michigander who lives, works, and contributes to this state. The term colored is a relic of another era, a time when our laws divided people by race instead of serving them equally. It does not belong in the 21st century Michigan Code Book. House Bill 4666 ensures our life insurance statutes reflects today's values, fairness, equality, and respect for all. This bill also makes small updates to fines. There is no fiscal impact and no administrative burden. Overall, this is a simple modernization effort, a small change with a powerful message. This body has a proud history of bipartisan cooperation when it comes to updating outdated or discriminatory language. Republican and Democrat leaders alike have taken these steps over the years because maintaining respect in our laws is not a partisan work. It is a moral and professional responsibility. As legislators, we are the caretakers of the words that define justice in Michigan. House Bill 4666 is our opportunity to continue that work, to remove language that divides us, and to ensure our laws speak to every citizen with the same dignity. I'm proud to sponsor this bill, and I humbly ask for your support in reporting House Bill 4666 out of committee with recommendations for passage. Thank you, Mr. Chair, and I'm happy to take any questions.
Thank you so much for being here. We are going to open it up to questions from the committee, but I think I'm going to start first. I want to applaud you for bringing this up. You and I both know there are so many things in Michigan law that people have forgotten about or not paid attention to. And the fact that you brought this up, and this statute, just for the record, was authored, what, in 1956?
1956.
Okay, we know times were different and they shouldn't have been, right? But here we are, it's 2025, and it's hard to believe that this language is still in our code. So thank you. I fully support you bringing this up, and we're going to plan on voting this out today, too.
Thank you, Mr. Chair.
So we'll open this up to any other members of the committee that have questions. All right. Thank you very much.
Thank you, Mr. Chair. Thank you, committee.
All right. We do have a couple cards of support that I'd like to read in. Dyke Vancouvering from Insurance Alliance of Michigan does not wish to speak, supports the bill. And Parker Fisher from DIFS does not wish to speak and supports the bill. All right. Next up on the agenda is voting out House Bill 4860, which is I had introduced and we heard testimony on at our last meeting on September 17th. And I believe I have a card of support to read in from Kevin McKinney, the Michigan Association of Orthodontists, does not wish to speak and supports the bill. And I need a motion to report 4860 with recommendation that it pass. Rep. Aragona. Thank you, sir. All right. Mr. Clerk, please call the roll.
On the motion to report, Chair Harris?
Yes.
Representatives Tisdale?
Yes.
Leitner?
Yes.
Posthumous?
Yes.
Aragona?
Yes.
Nair?
Yes.
Schutte?
Yes.
Carter?
Yes.
Tate?
Yes.
Fitzgerald?
Yes.
Witset? Mr. Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
House Bill 4860 is reported with recommendation. All right, we're also going to vote out House Bill 4666, and I need a motion to report with recommendation that it pass. Rep. Aragona again. You're going to be a workhorse today. Thank you. All right. Rep. Aragona makes that motion. Mr. Clerk, if you please call the roll.
On the motion to report, Chair Harris?
Yes.
Representatives Tisdale?
Yes.
Leitner?
Yes.
Posthumous?
Yes.
Aragona?
Yes.
Nyer?
Yes.
Schutte?
Yes.
Carter?
Yes.
Tate?
Yes.
Fitzgerald?
Yes.
Witset. Mr. Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
House Bill 4666 is reported with recommendation. I really don't like that number. All right. As a wrap-up, can we have a motion to excuse absent members? Rep. Fitzgerald makes that motion. Without objection, absent members are excused, and with no further business before the committee, we are adjourned.